2nd of November last year, my mom suffered a stroke right in front of me. We were able to save her, gone to hospital early enough. And about 8 weeks ago, my father suffered a stroke. If your pacemaker stops working, there is no drug that can be given to you to reverse that. Let me be clear. Exercise, it's important, full stop.
Okay.
Exercise is important, full stop. However, our bodies were not designed to do certain things that we push them to. And when in atrial fibrillation, when the patient is in atrial fibrillation, the heart is actually not pumping. It's just doing this. Hi there again, everyone. Thanks for being supportive and following us on a platform created by Creative Replay, because someone else said, who is this person behind the mic? I said, hey, I don't know. It doesn't want to come on the podium, but yeah, that's Mawande.
You have the
Creative
information.
Replay.
I'm just here to get it from you.
Yeah, so Mawande is behind all of this and all the success that we get and the information thanks to Creative Replay. And welcome to Rhythm Unplugged, episode number
4. We're already at episode 4.
Yeah. So today we're going to talk about the heart and the brain, more specifically the heart and the stroke. So Mawande asked me why this heart and the stroke. There's a personal story to it. So I'm 56. I'm very privileged to have both parents who are both 77. They are a few months apart. 2nd of November last year, my mom suffered a stroke right in front of me. We were able to save her, gone to hospital early enough. And about 8 weeks ago, my father suffered a stroke. So from two ambulant 77-year-old, relatively independent people, they are now basically housebound. So stroke is something very personal to me, and it's something that continues to happen. A lot of it happens because of the lack of information. And coming from where I come from, we don't have access to health, as we've discussed this before. So it's something very, very personal to me. So today we're going to talk about atrial fibrillation, aka AFib, aka AF. So yeah, that's what you're going to talk about today is the heart causing the stroke.
The heart causing the stroke.
Yeah.
So what does the term atrial fibrillation mean? Because when we were starting, I didn't even know that this is related to a stroke. Maybe what does the term mean, and then how do the two connect?
So most of the time, if you see a person, not necessarily a patient, walking funny because one side of the body isn't working well and you can tell it's a stroke, it's going to be one of the two things most of the time, not all of the time. It's going to be hypertension, high blood pressure, Zulu high, or atrial fibrillation, AF. So those are the two most common causes. A lot of people know about high blood pressure. It's still a major devastation, very preventable, very treatable, but still kills a lot of people. AF is even worse because most of us don't know anything about AF, right? So as a rhythm doctor, manages rhythm disorders, this is the most common abnormal rhythm of the heart. The heart is made of muscle, valves, blood vessels, and electricity. And other people define the onset of life by heartbeat in a fetus before the baby is born. So your heart has been beating ever since you were in your mother's womb because of the electricity that the heart requires to function. The electricity of the heart stimulates the heart to give the heartbeat. Heartbeat gives your body the circulation that it needs. We all have pacemakers. Everyone who's alive, every animal that is alive has pacemaker. As a matter of fact, we have 2 pacemakers, inborn pacemakers. For some reason, other kids born with defective pacemakers, so we have to put artificial pacemaker, because if your pacemaker stops working, there is no drug that can be given to you to reverse that. Simple. As you get older, I like the saying, you can't complain about the mud when you pray for the rain. We talk about it all the time. Now that you get older, We like it as long as we physically independent, mentally independent. We're happy, right? But there's certain things you can't control with aging. You can't control gray hair, wrinkles. I guess you can
100%.
now with Botox, right?
Hey, Dr.
Yeah, but I mean,
90210.
certain things will occur. And one of them is the heart rhythm changes because the electrical system and the heart muscle change. And the heart moves from beating regularly, such a way that it works, and you, as the owner of that heart, you're not even aware it's there. You're not aware that the heart is beating. That's good. Once you're aware that the heart is beating, particularly if you're over the age of 65, then it might be atrial fibrillation. The world population is about 8.1 billion. 1% of that is about 80 million people, bigger than South Africa. That's an estimate of atrial fibrillation generally. The older you get, the more likely you'll have atrial fibrillation, this irregular heartbeat.
So is this is something you don't get at a young age, or you don't see at a young age? Is it usually something that comes in the process of time?
Most of the time, yes. So, like I said, you get gray hair, you get arthritis as we age. One of the things that may happen to these individuals, forming 1% of the world population, 80 million plus, is your heart start being irregular. And most people aren't aware that this is abnormal. You know, may just say, I'm getting older, I'm aware of my heartbeat, I can't do things that I was able to do a couple of months ago or a couple of years ago. So it's generally a disease of the elderly. However, having said that, let me be clear. Exercise, it's important, full stop.
Okay.
Exercise is important, full stop. However, our bodies were not designed to do certain things that we push them to, i.e. ultramarathon runners, rowers, super fit individuals. You do age your heart and have these conditions that you would have seen otherwise in an elderly person.
Well, you just did something to me there. You said you age your heart.
Yes.
But now I'm under the thought that if I'm an ultramarathon runner, like that's as healthy as it gets. I mean, that means that, I'm healthy, I'm fit, I can enjoy such long distances. But now I think you're throwing something into the pool that I'm...
No, that's why I wanted to be very clear. Exercise is good, period. But if you over-exercise, and there is a thing, over-exercise, we're not clear of the definition yet. I'm not a sports cardiologist, but definitely there is a threshold beyond which, if you exercise so much, for instance, in South Africa, we have ultramarathon called comrades, 89 kilometers. And those people don't wake up in the morning and just go and run. They probably put in 200, 300 kilometers of preparations. Yeah, your body wasn't designed for that. So you do age it. I mean, easy thing to understand. You can have multiple injuries, right?
Yes.
That's wearing down your muscle. You may have joint pains. That's degeneration, right? That you wouldn't have if you're not running so much. So that's easy to understand because we run muscles, joints, but the heart as well, right? So when you over-exercise, then we know that some of the individuals, not a lot of those, but definitely a significant number of those people do age their heart and start getting this atrial fibrillation, irregular fast heartbeat. How does it present, this atrial fibrillation? Unfortunately, it can present for the first time with a stroke. We'll come back to that. But one of the most common symptoms, if you're lucky that you don't present with the stroke, you could present with sudden awareness of the heartbeat, shortness of breath, being irritable, symptoms similar to dementia, start being forgetful. Effort intolerance means that you could quickly run up the flight of stairs or two, and suddenly 6 months later, you can't do that, but you haven't put on weight, you haven't had any other issues, everything is still the same, but you can't do what you were able to do. It could be that. Yeah. So that's atrial fibrillation. It presents in different ways, but the most devastation is one might present with a stroke for the first time. You're not diabetic, you're not hypertensive, you don't have any infection, you don't have any brain vessel malformations, common things that can cause stroke, right?
Yes.
And there you go, and then develop a stroke. So why is that? Okay, go ahead.
No, I'm just thinking about a stroke. I'm realizing there's many things that could cause a stroke. I think, in the black culture, one of the main things for us is stress.
Stress noma ushawe inyoni,
Yes, yes.
bakudlisile, or someone is bewitching you, unfortunately it's just a simple thing, atrial fibrillation. The best way to diagnose it is having some sort of a recording. Now we've got smartwatches, but the traditional way of diagnosing atrial fibrillation is when a doctor does what is called ECG. In the US, they're called EKG, but ECG is the best way of diagnosing it. Bearing in mind that if you go to your doctor because you are worried of the awareness of irregular heartbeat, that makes you feel unwell. Unwell could be dizziness, shortness of breath, effort intolerance. And to go to a doctor on that particular day and your rhythm is normal and you may be mislabeled as you are good. It's all in your brain, it's all stress, it's anxiety. That doctor of yours may have gotten that wrong. Unfortunately, you need to have symptoms on the day, at the time doctor is doing ECG, to be able to say you have atrial fibrillation. Now, if on that particular day your heart rhythm is back to normal, because it can move from normal to abnormal, normal to abnormal. Doctor can do all kinds of blood tests, imaging, they won't find anything. You need that strip of paper called ECG to make a diagnosis of atrial fibrillation. And that becomes very profound because then we know how to manage this patient. One of the most important things is strategizing for that particular patient, whether you need blood thinners to reduce the risk of stroke. Now, if you look at the heart, and anyone can just go on Google, you'll realize that the heart inside is not smooth, right? It's got crevices, it's got pockets, which we don't know why. As you can see here, this is the inside, the model of the heart. You get all these pouches, right?
Yeah.
And when in atrial fibrillation, when the patient is in atrial fibrillation, the heart is actually not pumping. It's just doing this. So it means that the blood is not moving at a constant required rate of velocity. So we've got what's called relative stasis. So the blood is relatively stagnant. It's moving slowly, and the blood that is not moving well may form a clot. Clot in your heart will not cause any symptom. But if it goes to the brain, imagine if you form a clot inside the heart, and the heart is a very active structure, very active organ. You can squeeze this clot to the brain and stroke happens. It can cause other things as well. It's not just stroke, heart failure, which is probably the second most important thing, sudden death. All those things can happen.
So is there a specific age that if I get those symptoms, or general age, where I should be worried? So let's say, I'm 35, I get those symptoms. Is it usually something else? But maybe now I'm close to 70 and I get those symptoms, then I should be worried.
Absolutely. So the cutoff age obviously is not cast in stone, is that if you get to 65 and above, that's when you start seeing more patients with atrial fibrillation. Let's go back to the prevalence, the likelihood of this condition happening. In the general population, is about 1% to 2%. So we're talking about 80 million in the world. If you say 1% to 2%, up to about 150, 160 million people. But if you then subgroup these people between maybe 65 and 75, it might be a single-digit percentage, like maybe 3%. Get to about 75, about 10%. You get to octogenarians, people who are 80 and above, it jumps suddenly to 20%. So if you see a cohort of 1,000 80-year-olds, a quarter of them, or almost a quarter of them, will have atrial fibrillation. So it's age-related. It doesn't mean that if you're 35, you won't have atrial fibrillation, particularly if you're born with some congenital heart problem. Congenital means that you're born that way, or you acquire conditions, particularly, we know acutely about our history in poor social economies, things called rheumatic valve disease. The other time.
Yes.
And so a doctor has to cut out your valve because it's damaged and put in a metal valve. That also increases the risk of stroke, having that condition, or even having that new valve. You need to take blood thinners. So yes, younger people can have this, but generally, if you don't have any heart disease, you're not an ultramarathon runner, you're not obese, you're not hypertensive, you're not diabetic, you're less likely. But you could have no conditions. The only issue is that you're 75 years old, like my parents are both 77 years old, and have that devastation of a clot going to the brain and causing a stroke.
What are some things that we can practically follow now, but things like we can set in stone, that we can upkeep and do, like, for example, exercise or keeping a healthy weight, to try and maybe minimize, even though maybe you might not be able to eliminate these things, but at least minimize them,
Yeah, there are a lot of things that can be done. Sorry to interject. There are many things that can be done. There's this started in South Africa, like knowing your numbers. I think it started with HIV, know your CD4 cell count, and knowing, the viral load, and then people then went to diabetes, know your glucose level, then went to blood pressure, basically knowing your numbers. So basically knowing your heart rate. Your heart rate is usually about 65, and suddenly your watch is telling you your heart rate is 110 and you're not doing anything. So those things are important. But we also don't want people to be neurotic, because sometimes you can think you're solving a problem, you're causing a new problem. For instance, someone with a smartwatch, every odd beat, this thing tells you abnormal heart rhythm. And then you start getting worried for something that is trivial or not necessary. We're not saying people should be neurotic, but just know your heart rate. If you're in the space of maybe exercising, you know your heart rate. But more importantly, is weight management. And most of the time, if you can, obesity is one of the biggest things. So in prevention or managing atrial fibrillation. So if you can lose about 10% of your current body weight, most of the time you will reverse or mitigate or defer the development of atrial fibrillation, right? So weight management, diabetes, high blood pressure, very common conditions. Let me go through those again because they're very important. Diabetes, high blood pressure, and obesity, right? So very, very important. Then another group is alcohol. Forget the myth, that a glass or two is good for the heart. There's nothing like that.
How did that come about?
We'll talk about that some other point. Yeah, man. Alcohol is good to wind down, let your head down a bit, but there's absolutely no benefit in alcohol. Absolutely no benefit, except maybe just feeling good, which is fine if you can manage it. But alcohol is one of the biggest triggers of atrial fibrillation, particularly if you are dehydrated, right? So alcohol, sleep apnea. Have you heard of sleep apnea?
I've heard of the term, but I'm not sure what like.
So sleep apnea is not necessarily snoring. It generally occurs in people who are overweight, but not, you could be skinny and have sleep apnea. But basically what sleep apnea means stopping breathing. During sleep, you may wake up 200, 300 times a night and you are not aware. If you have a partner, it's not just snoring, it's stopping breathing. So much so that your partner might, give you a nudge to wake you up because they are aware that suddenly you stop breathing. Now, there's different degrees of sleep apnea. So the best way is to have what's called sleep studies, where basically technologies look at how much you stop breathing and less oxygen circulating in your system. So sleep apnea is one of the biggest causes or association with atrial fibrillation. Very common, very, very common. So those are things that we can manage. So if we're to go through those triggers again, smoking, we didn't talk about it, is also big. Smoking, reduction in taking excessive alcohol, particularly if you don't dehydrate. Losing about 10% of your current body weight goes a long way. Managing your diabetes and hypertension goes a long way, and management of sleep apnea. And the unfortunate thing about sleep apnea is that there's no pill, right? Forget about all these gadgets that you see in this platform. There's no pill. The best way is something called a CPAP mask. You see these people sleeping with.
I've seen people, yeah.
Nobody likes using it, but they will use it because they feel so good in the morning. Yeah, because if you've got sleep apnea and you're waking up about 200, 300 times a night and you're oblivious of it, you wake up in the morning, you want to hit a pillow again, right? Because you're just so tired.
The body hasn't
Blood pressure
rested well.
goes up, and we can talk about sleep till cows come home. The importance of sleep is not overestimated. You need to sleep. So if you don't sleep, other conditions creep in as well, like atrial fibrillation. So people don't like using CPAP masks because it's just, it seems ugly, it doesn't fit well. But patients who really get the benefit, they'll continue to use because they feel so much better. So those are the things that you can...
You can do. Yeah, I think, that's so informative. AFib. Is there another common term for this? It sounds like a very technical term. AFib.
Unfortunately, I can't think of any. Zula, Liko, I don't know, in Afrikaans or in other languages.
But I guess the short way is AFib.
So most of the time you'll hear people talk about AFib, atrial fibrillation, FIBRILLATION, fibrillation. Basically, literally means that the heart is not pumping, it's just doing this, and the blood isn't moving forward the way it's supposed to be. Yeah, so this is a personal story. Both parents, 77-year-olds, currently housebound, almost bedbound because of a stroke. And remember, one day you are walking, mobilizing, working your garden, whatever you do, next minute you either dead or bedbound. You need someone to change your diapers at the age of 77. That's not a nice feeling, right? And unfortunately, these things are preventable. And unfortunately, we still get a lot of people having stroke on preventable issues.
Yeah, no, Doc, thank you for being just personal and sharing that with us. I think it goes to show that the work that you do really means a lot, because then people can start to make different decisions about their health. And it's close to home.
Yeah. And we didn't even talk about the medical intervention other than advice. So piece of advice is, one is being aware, and that something is wrong. Don't just say, I'm getting older. People put to age and I'm getting older. And once you have a diagnosis confirmed, is whether you need to be on blood thinners or not to mitigate the complications of a stroke. And your doctor might prescribe certain medication or might refer you to an electrophysiologist who can do certain procedures, but not everyone benefits from this kind of procedures. If you go and see them early, this procedure is called ablation, 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 do work well in subset of patients who are the best candidates. Unfortunately, most people, by the time they realize they've got atrial fibrillation, they've had it for many years, and the heart is just maybe too big to do any procedures. But even then, there are things that can still be done.
Do you say the heart is too big to do any procedures?
Yeah, so one of the things that might happen with atrial fibrillation, we said one is stroke, the other one is heart failure. So when the blood pulls and doesn't move forward, one of the worst things that can happen to the heart itself now, not just the brain, to the heart itself, it dilates, it gets bigger and bigger and bigger to a point, like an overinflated balloon. You know, it doesn't come back to normal size even if you deflate it, right? So no matter what you do at that point, I mean, the horse is bolted. I mean, there are other things that you still do, like insertion of a pacemaker and regularize the heart via pacemaker. But most of the time, we opt for that because we've made a diagnosis way too late to intervene either with medication alone or with ablation as a primary procedure.
Sure. So basically, for just information purposes, if you feel you have the symptoms that you mentioned before, either, I think you said awareness of the heart.
Yeah, that your heart is beating. Shouldn't be aware, particularly if it's constant, recurrent, and is causing you some sort of discomfort, like shortness of breath, effort intolerance,
Then
tiredness.
an ECG would be a good idea.
It's the best idea.
Do you suggest just annually when you're doing your medicals to get an ECG?
No, not really. I'm not sure if it's cost effective. I think in a
Okay,
setting
right,
where maybe you're older, you're having these recurrent symptoms, but not routinely. Because, I mean, when you go routinely doing your blood pressure, your heart rate is going to be part of that blood pressure assessment. No, I wouldn't recommend that you should do ECGs for everyone every year. No.
But maybe from a certain age going forward, it might be something good to add.
Yeah. Maybe you can say, for instance, if someone is considered to be high risk for having atrial fibrillation, 75 and above, diabetic, hypertensive, obese, drinks a lot, smokes, then yes, for sure, for sure.
Sure. Doc, thank you so much. It's always good to have these conversations.
Yeah.
But more than that, it's always good to learn and it's always good to debunk some of these myths. And we hope that, people can take this information and apply it. I think more than anything, be aware of it and apply as much as you can.
Okay. Let's just debunk for 5 seconds. It doesn't mean that because you're getting older, all your symptoms are related to age. It could be a condition like AF that can be managed. All right.
So just because you're getting older, it doesn't mean that it's...
Your symptoms are related to age. It could be a condition that is related to age, not that the symptoms are age-related. I think those are two different things.
Those are two different things. Now you're making us think because you're using big English.
No, so...
yes, give us an example, yes.
Gray hair, right.
Yeah.
It's age-related.
Yeah, true.
But when I'm short of breath and I'm 75, I shouldn't be saying I'm short of breath because 75 is as good as having gray, right? So I'm short of breath. I'm having a condition that could be age-related, i.e. atrial fibrillation or heart failure. I still need to get sorted, right? So that's a difference.
There is a difference, okay.
I've got gray hair because I'm old, but I shouldn't have symptoms of heart failure just because I'm old.
Okay, I'm with you. So rather than just letting it slide, and oh no, it's age, you might find it's actually a symptom of something that needs to be attended to.
And can be.
And can be attended to, yes.
Yeah.
Okay, you see now you're making us think, John. Not all of us catch on as, Sure. Yeah, I think that's good. I think it'd be nice to have more conversations to dive deeper into the topic, and maybe look at different angles, But I think as an introduction to understanding AFib, hey, at least I remember that.
AFib, yes.
AFib, yeah. I think it is. Yeah, I think it is such a good understanding, and it's also very different to. Maybe this is good. In the last one of the episodes, I think it was episode 2, we spoke about the differences between heart attack, heart failure, and cardiac arrest. How does AFib relate to all of those three? Is it something completely different?
Well, you can't untie it from these other medical conditions because, say, for instance, you've got heart failure. There is a high risk that you may have atrial fibrillation as a consequence of heart failure. That's number one. Atrial fibrillation can cause heart failure. You're starting off with a structurally normal heart and you get atrial fibrillation, and atrial fibrillation causes heart failure. So sometimes the chicken and egg, when you see the patient both with heart failure and atrial fibrillation, right? You don't know which came first. So they are intertwined. Let's move to cardiac arrest. Yeah. So someone with atrial fibrillation is at a higher risk through certain mechanisms, because it's still the same heart that is affected, right? When in atrial fibrillation, it can cause what's called sudden cardiac death, or AKA cardiac arrest, right?
Okay.
Right.
Yeah.
I'm trying to think. We're going to a triad. So we've spoken about atrial fibrillation and heart failure. We're spoken about atrial fibrillation and cardiac arrest. I'm thinking about atrial fibrillation and heart attack.
Heart attack, yeah.
Heart attack can also cause atrial fibrillation, but we're not sure if atrial fibrillation as a standalone can cause
A heart attack.
heart attack. What it can cause is angina, which is a particular pain that one gets when there's not enough blood flow to the heart. Now, for instance, let's say you have this chest pain, you're not sure whether it's indigestion, or if you're a doctor, you're going to think you've got indigestion because I can't have heart attack, I can't have angina. So you don't know whether it's indigestion, aka heartburn, or you're having actual problem with your heart. When you go to a doctor and you're narrating this story, but you don't have chest pain at that time, doctor might put you on a treadmill and make you exercise to see if you can reproduce the symptoms, as well as some sort of changes on the ECG as you exercise. Because when you do what we call exercise stress test, we're looking at many things: your blood pressure, your heart rate, your heart rhythm, and your symptoms. We're listening to you, we're looking at you. So you might have angina for the first time when your heart is going fast, because when in atrial fibrillation, your heart can go to 200, can go 150. So you can see that from the three previous topics: heart failure, heart attack, cardiac arrest, atrial fibrillation can be part of this triad. It's all intertwined.
It's all intertwined.
Yeah.
Well, that's episode 4.
But the most important thing, it can be diagnosed, it can be managed.
I think it's always good to mention that before we close.
Yeah.
The awareness was that it can be diagnosed, it can be managed.
Yeah, it's not doom and gloom.
And there's people like you and other teams and different, you always say what? There's plumbers and electricians.
Yeah. So there are electricians out there, electrophysiologists.
To help with this.
Yes.
Sure. Any last thoughts with regards to this topic for today?
Well, like I said, you asked me why, and you asked me for a story. I didn't tell you a story beforehand. For me, it's personal. But also think about it. Over 80 million people in the world. That's more than the entire South Africa have atrial fibrillation. And the vast majority of them are not even aware they're going to wake up with a stroke one day. Someone is having a stroke right now because of atrial fibrillation, right?
Sure. Looks like there's some work to be done in educating.
Yeah, so it's not a rare condition. It's not a rare condition.
Not a rare condition. No, it looks like some work has to be done, and I guess this is what we're doing. This is the work being done.
Yeah.
Educating people, and just so people also know, with regards to their loved ones and so forth, what are some of the things they should, start looking out for. But yeah, thank you, Dr. V.
Thank you to Creative Replay, and here we are, Rhythm Unplugged. Thank you.